Module 3 discussion, and then we have Stephen Hoff, Carrie Goltz, Citlali Irales, and Brianna Griffin. Case study, Steve was a 75-year-old retired plumber who developed an abscess on his wisdom tooth. His dentist prescribed an antibiotic, clindamycin, for 14 days to treat the persistent abscess until his scheduled root canal. After Steve finished his entire dosage of clindamycin, he started to develop smelly diarrhea, an upset stomach, and pain in the lower abdomen. The diarrhea was worsening and occurring up to 12 times per day. He was admitted to the hospital, and his attending physician decided to test his stools for possible infection. So what is the potential pathogen? So clindamycin can be associated with serious side effects such as pseudomembranous colitis, nausea, vomiting, and diarrhea. And then the side effects of this antibiotic upsets the delicate balance of normal gut flora and allows for the growth of Chlorstridium difficile, which is C. diff.
And then the type of microbe that it is that it's a gram-positive spore-forming bacteria, and their optimal temperature is 37 degrees Celsius, which is 98.6 degrees Fahrenheit, which is normal body temperature. The oxygen requirements is it's anaerobic, which means it thrives in environments without oxygen. And then the pH is typically between 6 and 7.
For eradicating C. diff can be challenging due to the ability to form spores, which are resistant to heat, chemicals, and desiccation. Some effective methods include disinfectant. Using bleach-based disinfectants can kill C. diff spores on surfaces, especially in a healthcare setting. Proper hand hygiene, washing with soap and water, is more effective than alcohol-based sanitizers, which do not kill spores. Specific antibiotics can target the active vegetative form of C. diff. Infection control, isolation of the infected patients in hospitals is critical to prevent the spread of spores.
Discussing some different forms of treatment for C. diff. The main thing would be antibiotics. Antibiotics are the main treatment for C. diff infection. Commonly used antibiotics include vancomycin or fidaxomicin. Some treatment plans include, again, antibiotics, or you can do an antibody-based therapy. Therapy known as besletoxumab, which is a human antibody against C. diff toxin B. Or you can use fecal microbiota transplant, or FMT, which is a new treatment for C. diff infections that keep coming back. And this newer treatment has been studied in clinical trials, where basically what FMT is that it restores healthy intestinal bacteria by placing another person's or a donor's stool in your colon with specialized tubes inserted through your rectum. Another form would be probiotics. So probiotics are good supplements or foods that have microorganisms to keep or improve the good bacteria in your body. The role for these products in C. diff infection are not clear, but researchers are studying advanced probiotics for treatments or prevention of C. diff infection, and these products are offered outside of research studies.